Now I'd like to introduce to you Debbie Lambert, the Director of Clinical Excellence at Novant Health Brunswick Medical Center. Thanks so much for being here today, Debbie.
Thank you, June, for having me. I'm glad to be here.
Good. I like to start out my show by learning more about my guests. So tell me a little bit about your education and your background.
So I am a nurse by trade. I have 37 years of healthcare experience, 27 of those being a nurse. The first 10 years I was respiratory therapist. So started out my career early.
When you were 12, right?
Yeah, no, 19. So, but my background is mainly critical care nursing and stroke care is where my expertise lies. And I have a bachelor's and a master's degree in nursing, and my master's is also within healthcare leadership.
You've been a nurse manager too, right?
Yes, I have been a nurse manager for, I think I did that for about 19 years.
Wow.
So I have, leadership was, really my focus.
Right, yeah. So with all that background in bedside nursing, and then you were a nurse manager here at Novant Health for quite a while. So why did you decide to switch to your current role? What about clinical excellence drew you to that?
Well, the quality and safety of patient care. Being a nurse, you want to make sure that you are giving medications correctly, that you are following all the standards that you know that you have to make sure there's no poor patient outcomes. So I really was drawn to looking at, high quality, safe care and what all that encompasses.
Yeah. Well, so your big goal is just to make it safer for all of our patients.
Absolutely.
Is that your number one goal?
Absolutely. And so the role that I have now does focus higher level quality and safety. Healthcare has many regulations that are set forth from the Center of Medicaid and Medicare services and Joint Commission. So there are,
There's
regulations that we have to follow. And so they're set in place to keep our patients safe. And so that's what I get to do is I get to look at the bigger picture.
So how do you do that? What's your day look like?
Oh, very interesting.
You look at charts a lot, don't you?
A lot of charts, working with different department managers on process improvements, things that they may see in their area they have some opportunity in. It's a wide variety. We look at readmissions of our patients. Every patient that's readmitted within 30 days, we're looking at that to see did we have an opportunity, and getting the right resources, why they had to come back, length of stays, because there's a lot of
there's a lot of
standards around
taking
care of these patients.
Well, I know that we participate in Leapfrog. And so I don't know if anybody out there knows about that. So tell me what Leapfrog is.
Leapfrog is kind of like, it's your scorecard. Like if you were in school and you get scored in certain areas, and it's a quality scorecard. They give you a hospital safety grade, and I'm proud to say that we're an A, and we have been an A for several years now in a row. So that really means that what we're doing, we're really doing it the right way, and we're using our best practices. And, we benchmark against other facilities and look at, who's doing it this way or that way so that we can make sure that we're improving.
So we're an A, and we've been an A for a long time.
Yes.
And I know an important safety metric is hand washing. And I think there's something new out there that monitors hand washing. So tell me about that.
So the system that we have is called SwipeSense. And it's a sensor technology. It's in the cloud. The cloud is the big technology now that people are using. And it actually, each person has one with their badge. It's a little tile that's connected to their badge.
Oh, okay.
And so when they go to enter a room or come out of a room, the foaming hand washing systems have a sensor. So it's picking up that you have foamed in, and then as you come out, foamed out. The sensors are set up as like I believe through the Wi-Fi system connection.
sure.
So it's
So it
very
records
high
you
tech. It's,
every time somebody foams
Yes.
their hands with the at the dispenser and foams in and foams out. It records that.
It
And so
does.
then, as that's part of your job, you monitor those swipes.
We
right?
monitor those. The managers can see down to the person who's responsible for that, and it's an accountability piece,
Right.
and it's a responsibility. And
Yeah.
you know, we know that hand hygiene is the best way to keep infections down.
Right.
You know, even at home, it's
Right.
good to have that practice.
So part of your job is to read the surveys that we do, that patients fill out. Is that correct?
Yes, our patient experience surveys, yes. We get those through a third party. It's not a Novant company that does the surveys. We get the results and comments, and we take the good and the bad, and we use those to improve our processes.
Oh, that makes sense. So you do track patient satisfaction, and that's how you
Absolutely,
do that.
Yes.
And I laugh when you said you track the good and the bad, because that's how you learn.
Yes,
If people are honest and tell us exactly what they experienced or felt,
Yes,
then you can take steps to correct that.
absolutely.
Yeah.
Absolutely. It's,
Well, I think without you, you could be a really sick hospital if we didn't have people like you.
yes, and it's a big team. It's
It's quite a big team.
part of a bigger
Right.
the bigger system.
And every hospital, every Novant facility has this
quality
position.
directors, safety directors,
great.
and nurse analysts who are behind the scenes,
Right.
drilling into the charts and keeping us abreast of what's going on.
Yeah. Well, that's a very interesting job, and I really appreciate you coming on to tell us about it. And I hope that once this COVID's all over, you'll come back and tell us how we did through this whole thing.
I would love to.
All right. Thanks again for being here today.
Thank you.